Come on, praise God. Glad to see all of you. It's just good to be in the fellowship one more time. And all of our virtual audience, good to see all of you. We're delighted. I want Dr. White to come. The vaccine, he has not talked to us since the vaccine has been here. Come talk to us and bring us an update. We're delighted to have medical professionals here, and we're delighted to have, praise God, Dr. White, our medical doctor. God bless you for being here.
To all of you, good morning, Pastor Swift. Thank you again for allowing me to stand before you this morning. As you all know, the epidemic with COVID-19 continues to ravage our country, our state, and our county. You know, we have meetings regularly and keep abreast of the counts going on. And the last time I checked for the state of Alabama, we had reported to date 399,150 cases. And within the last 2 weeks, we've had 57,687 cases. And I mean, there was a time where those numbers were what represented the United States. And now we are well over several millions in the United States. Several million people are dying. I heard on the radio this morning somebody was saying he didn't know why people were making all this fuss about COVID-19 because in his circle of friends and people, he didn't know anybody who had COVID-19. I'm like, what planet is this guy living on? But I tell you, our facilities have been stretched. The hospital, we have, we keep tab again of how many people we have in the house, and we up there in the hundreds and 50s, 160s, 170 patients in our facilities at any given day these days. And I remember when we had 24, 34 or so. Our ICUs are getting to capacity. We're like 80% or more of our ICUs are filled. So we are having a hard time. But we all can still help our community. And as Pastor said, we still need to stop this virus. We need to not have substrate and people who this virus can infect. So we need to continue to do what we're doing, wearing our masks, doing our hand hygienes, doing our social distancing, refrain from gathering in groups for long periods of time, refrain from loud talking and all these kinds of things. These are the things that will continue to spread this virus. And our hope is going to be on the success of this vaccination program. And vaccination causes a lot of people to get immunity, and those people will help protect the people around them. There are all kinds of strategies out there about how, to get the vaccine. We're trying to give it to people who are up in the front line, people more at risk, and all of that. And I'm telling you, although there are several vaccines that are out there, the science is good about any of all of them. I have had my initial dose already. In another week or so, I will be taking my second dose. So I encourage you all to please take the vaccine when it is offered to you. In the next hopefully in the next week or so, right now we're in a class called 1A. That means the frontline workers, the healthcare people, and all of that. And then we're going to go into 1B, and 1B will expand it to firefighters and emergency room people and people over the age of 75. They have been brought that into the 1A class now that you're going to be able to get the vaccine. There was some information released this week that the Department of Public Health will be offering the vaccine on an appointment basis for those 75 or older. There's a number that you can call to schedule that vaccine. That number is 1-855-566-5333. I know you may not get through the first time you do, but try it. 1-855-566-5333. And you should be able to schedule a vaccine. The hospital has a facility in the parking lot of the laundry where we were doing the testing. We also have set it up to be able to give vaccines. And at the appropriate time, that area is also going to be available to give vaccines to people over the age of 85 and the firefighters and all these things. So keep your ears out there. There will be a separate number to call to schedule it at the DCH facility. So please, folks, this thing is serious. Let's try to protect ourselves. Let's try to protect the vulnerable among us, the elderly people, those who have chronic health conditions and all of that. And when the opportunity arises for you to get the vaccine, please roll up your sleeve.